Welcome to my podcast. Today I'm going to talk about another case. So basically, after you introduce yourself, as we all agreed, as always, and double check the patient name and date of birth, you'll ask the patient, "How can I help you today?" So the patient might say that, "Doctor, I'm feeling I'm not well. I'm feeling that I'm all the time. I'm nervous. I'm feeling like I'm on the edge. I feel my heart is racing." So you could tell her, "Could you tell me more?" And then you will ask the specific question, say, for instance, how long ago all of that started? What else did you notice? Is there any history that you could think of could be related to? What's your idea and thoughts about what's going on? And then you will ask, say, for instance, if she says that she's feeling nervous, she's feeling her heart racing, tell her, is there any occasion whereby you feel so? And how's your diet? How's your weight? If you have noticed any loss of weight, how's your bowel? Do you open your bowel? Also, if she has lost weight and if she's not eating well. And then you will ask her if you have any family history with the same problem, and if there's any past medical history of any significance. For instance, if there is a history of regular medication intake, if there is a history of allergy, what's your lifestyle like, and do you work, all of that thing. So the patient might say that, "Oh, I feel like I'm heat intolerance or cold intolerance." Might say that I'm having diarrhea, I'm having weight loss, all the time I'm nervous. So all of that could be pointing out in some differential that you could think of, like overactive thyroid gland, or if there is bumps and lumps and weight loss, you could think of cancer. If it's a young lady and is not eating and extremely doing or going to the gym, so it could be pointing to anorexia nervosa. And also not to forget about some women who are overweight might take laxative to lose some weight. So all of that should be kept in mind. And then after you took the history, you'll ask the patient that I would like to have a look. So you'll start with the observation basically. So you check her pulse, you check her blood pressure, respiratory rate and temperature. And then you'll examine the chest and the heart and the tummy, and then you will examine the thyroid, and you'll take it from there. And also you will inquire if there is any other associated symptom, like for instance, if it's a young woman, she will ask her about her last menstrual period, what's her moods like, and if there is any trigger. And also not to forget about because in certain cases there might be a history of hair loss, which is very important for women. So she will be like anxious. So you need to inquire about that and ask her in a gentle way, are you free? Are you okay to talk about the issue? How this makes you feel? And then you will tell her that we will do some blood investigation just to rule out if there is anything that we are not missing. So I'll send her for the routine, including thyroid function test, and if there is any need for a thyroid scan. And then you will agree about a management plan with her. So in this situation, for instance, if she's a young woman, you will ask her about if she has already children, or if she's looking into that. So if the woman, for instance, is planning to be pregnant, you will you will give her parathyrouracil, and if she's not, and also you'll send for anti-thyroid antibody as well, just to rule out any autoimmune disease. And then you will agree with her what sort of medication could be started, like carbimazole, for at least 18 months, and then you will see how the patient responds, and you will do regular checkup just in order to rule out any side effect might raise while she's treated. And for the tremor, and if there is any heart racing, you will think about beta blocker, so like propranolol. And if all of that does not work, there's other choice for the radioactive iodine treatment, and surgical, which can be the final stage. If it's the other way around, if it's a woman who might be older and might say that I'm feeling all the time, I'm tired, I'm feeling sleepy, I notice I'm gaining weight, having constipation, I'm having slow heart rate, or short of breath. She might notice that her skin is becoming dry, hair is sparse. She might say, and I'm not able to tolerate the cold, and the hair can be brittle or sparse. So in that situation, you will start thinking about hypoactive thyroid, or autoimmune like Hashimoto, or viral illness, which can be preceded, or if there is any medication that she's taking, for instance, for other diseases like we know, for instance, lithium and amiodarone can cause hypoactive thyroid. So you will agree with the patient that you will have a quick look, examine her, and also, as I mentioned in the previous one, you need to ask about any past medical history, any idea or thoughts the patient might have, if there is any family history of the same problem, and if there is any medication that the patient takes on a regular basis for anything else, any allergy known, what's the lifestyle like, and if the patient is a smoker or a drinker, what's their situation, and if they are working, for instance. And then you will agree with the patient that you will send for certain blood investigation, the routines, and the thyroid function test. You might include ECG as well, and total lipid profile. And after you get the investigation, you will agree with the patient what sort of medication can be started. So you will give her like a replacement for the thyroid hormone. So that's basically thyroxine. If the patient sounded depressed, she's not coping, you can suggest also with her talking therapy, like CBT. And then you will ask her, she can be more productive and active if she can at least walk around, try to grade in a graded exercise way. So it means like you can start by walking few steps each day and try to increase them gently and gradually, and try to take a positive attitude and being proactive. So by that, I just briefed you about a condition which is common also in Lab 2 station. I remember my case was hypothyroidism. So basically, you need to ask the relevant questions, the main symptom of the patient that he's presented or she's presented with, and then you will build up about it and around the symptoms. Thank you. And before that, always you tell the patient if he didn't feel any well or any better, always safety net the patient for any case. Thank you.